TV here in Walthamstow, UK. You are welcome to Let's Talk About Health. Of course, I'm your host, I'm Mrs. Winnie Ohinekisi. Tonight's presentation or topic is quite juicy, and so I'm looking forward to it. Contraceptive choices for women. I'm sure my guest or my viewers who are men will have a big problem with that. Why we didn't talk about men, but I'm sure there will be an explanation for that. So guys, if you've not phoned your friends or family to watch this one, please do me a favor. Just tune in, watch, and get people to join in as well. I've got a special guest with me tonight. I've been looking forward to having her here for a long time. So I feel very privileged to have you in the studio. Just say your name and what you do, really.
No, first of all, thank you for having me here. You know how much I admire the work you do.
Oh,
so you're saying it's a privilege, but it's a more privilege for me to be here. So thank you. My name's Edith Barber. I am a independent prescriber and I'm a nurse practitioner.
Right.
So my speciality is basically sexual health, women's health, contraception.
Yeah, I mean, back in the day, I was so much into sexual health.
Were you?
Yeah, because I trained in Ghana as a nurse and as a midwife. And there we had to literally do everything. And we didn't have too many specializations in different areas. So I remember having very interesting conversations in contraceptive use and all that. But it's a long time ago.
Okay.
So I'm looking forward to this one. Why this topic, though?
Well, you know, a very famous quote, let me start with that. Michelle Obama said, there's no limit to what women, you know, can achieve or what we can accomplish. And unintended pregnancy by any young person or childbearing age would distort that process. So I'm very woman-centered with care, and I believe getting the facts right, you know, and women's body, they should have a right to dictate when they want to, you know, bear children, when they want to conceive. So I think you've got a lot of advantage if you're well informed.
I guess so, because especially when you come from where we come from in Africa. Obviously, I'm from Ghana, and you are from Sierra Leone. And I don't know how it is in Sierra Leone, but in Ghana, these topics are not ones that we really put out there to people. Everything is private.
Absolutely.
Just as private as the area we're going to be talking about. Yeah, so that's why I'm interested in knowing more.
Yes.
And like I say, I love my health professionals to come here and to share all the topics that are all the areas of their specialization. So you are welcome to Omega Studios. I hope we'll have fun. I'm sure we will.
Yes.
Yeah, and I'm so looking forward to it. Now, majority of the people who watch this program are probably my age or my friends, my colleagues. So I would say that most of us probably don't even think about this topic, you know, but then we do. Why? Because we've got to the stage where our children are having children or are the childbearing age as well. So surprisingly, most of the people who contacted me regarding this topic are my mates wanting to find out information for their children.
Yes.
Yeah, so it's very important we do this. Can you just give us like a biological background to all of this?
Yeah, I'll start off by saying, you know, be as not too descriptive with my medical terms, but our body, it's a very clever organ. It prepares us for pregnancy every month, you know. I have a little diagram which I'll bring in.
Yeah,
so this
is
is the womb. This isn't the actual size in real life, but this is just, you know, as a demonstration purpose.
Yeah.
But the actual size of a womb is like a boiled egg, that kind of shape. That's
small.
sitting in here. Yeah.
So this is even bigger?
Yes, because this is just for demonstration purpose.
Yeah.
So as I'm sitting, this is my womb, and we all have 2 ovaries. So every month, whether the right or the left, it would release an egg. So it releases the egg with the hope or the intent that a sperm would fertilize it, and you know, you'll get pregnant. If that doesn't happen, the egg, the mucus, and the lining of the womb all comes out as menstruation. So when a woman sees her menstruation every month, it means she hasn't conceived.
Okay.
You know, we're born with millions, over like 1 to 2 millions of eggs as a baby, and then by the time we start having puberty, you know, we might have 300 to 400,000 eggs left. Okay. And by the time we're in the menopause, we have about 10,000. So you never run out of eggs. Right. Let me put it like that.
Oh, that's a lot of eggs.
Lots of eggs, yes.
Yeah. How do you find like our people, and I'm referring to our ethnic minority groups, with respect to their acceptance of contraceptive, you know, like what is on offer in terms of that?
I think, you know, just with the African culture, contraception isn't openly spoken about, it's not discussed. I think if somebody was to want to start that topic, it's a bit like, why are you even thinking about that? You shouldn't be having sex. There's a whole stereotype to say that this person is only when she's married or when she's of a certain age, you should be talking about contraception. You know, they might say, why, if you were to have an assembly of young people now, like, how dare you speak to my child, she's only 12. But the thing is, just like in the UK, if you don't talk or you don't have that relationship, you know, with your child or your friend, or they're going to learn it from the internet. You know, when I was, you know, I tell my daughter, when I was her age, there wasn't all this technology and Instagram and TikTok and all this kind of things that actually teach your children whether you like it or not. It's not everything that's censored, so it's better they have a proper, you know, censored sort of education, be it from their teacher or their, you know, colleagues or health professionals like we're doing now. So it's quite important, isn't it, to touch on these topics and just remove all the myths and things that exist.
You reckon we should have these conversations well earlier?
Absolutely, yes. As you know, as soon as a child or a girl starts having her menstruation, she's at risk of conception. Obviously, you know, if that child starts early, you sort of frame the conversation according to their age. But yeah, it's a topic that should be not like a taboo, but it should just be just a normal conversation.
Yeah, and in terms of how much information you give out to them, will there be any limit, or you just go all out to let them know?
I think you tally your phrase. Obviously, if I'm talking to a 10-year-old versus I'm talking to a 16 or an 18 or 21, sort of, you know, it's different. But absolutely, you know, you must cover all aspects.
For this topic, obviously, we're referring to people who are sexually active, I guess.
Of course.
Yeah, so if the person is not sexually active, do we still have the conversation?
Yes, because sometimes with, you know, that person being sexually active is unplanned, or it just happens. So that person must be able to know what's available for them. If someone's not on contraception, they must be aware about the types of emergency contraception that exist. You know, the definition of contraception is an intentional use of either an artificial method or, you know, other sort of prevention ways of avoiding intentional pregnancy if you are not wanting to be pregnant. However, if someone's not on contraception, you know, that person can also be aware about the emergency types of contraception that you can take. You know, we call it loosely like the morning after pill or, you know, a coil. You know, they need to have all that basic knowledge.
I think we will probably have a look at all that into details. But statistically, how many people, like especially across the country, according to the age groups, are even using contraceptive methods? I
think there should be more people, especially the, shall I say, the under 25s, because there's a lot of myths about, oh, you'd be amazed what this, you know, what I get from these young people. I don't know where on earth they get all this information about, you know, if you have sex standing up, you're not going to get pregnant, or if you have sex for the first time, if you have sex while you're on your period, you know, there's a lot of things that, you know, there needs to be clarity on that.
Definitely. And in terms of no use of contraception at all, contraceptives at all? If
100 people were, you know, having sex, you know, per year without being on contraception, 85 will get pregnant.
That's a very high number.
Yeah. So 85 out of 100. And, you know, some people also believe in the pull-out method or withdrawal method, and, you know, wanting to sort of trust their partners to say, you know, the partner might tell you, I'm in control, I will not ejaculate. And obviously that's sort of naive. I think as a woman, you also have to play a part, isn't it? Yeah. And, you know, and withdrawal method, I always tell patients there, and they're like, oh, really? can I get pregnant from that? Pre-com does contain sperm, and if it's fast swimmers, it can get you pregnant.
Yeah.
Like the failure rate of the withdrawal method, again, out of 122 will fail. They will get pregnant if they were using.
Yeah.
So it's not an official sort of
Okay.
method. Otherwise, why invent contraception? Everybody will be
Yeah.
pulling out, isn't
I was
it?
thinking the percentage would be higher than that, though.
Yeah.
Isn't
But
it?
perhaps they have updated, but 22 in 100 women will get pregnant in a year for
Yeah.
sure if they're doing the withdrawal method.
Yeah.
That doesn't mean to listeners that should be,
Yeah.
practice, because the percentage isn't that high. It's still, not something I would advocate. Absolutely.
There are ways around it, isn't
Yes.
it? So it's better considering the stress of being pregnant and not wanting
Yeah.
the pregnancy. Yeah. So this is how the overview in the UK, for instance. Yeah.
Yeah.
Mm.
But it'll be interesting to see the data from Ghana or Sierra Leone or West Africa. It will be that's
Yeah.
another topic on its own, isn't it?
Right. So now, can we actually delve into the methods, because I think that is what people will be keen. And I think I am interested as well, because not for any other reasons that people will be wondering why is he so keen to know. Yeah. But I think these are the things that people struggle with the most, isn't
Yeah.
it? The different types. So if we can just take them one after the other,
Yeah.
look at the
So
different types of contraceptive.
I have a few here, but obviously not all.
Okay.
There are different types of contraception. You've got contraception that does the job for you, and you've got contraception that depends on you to make it work. So that's the sort of easy category. I can separate it initially to begin with. No contraception makes you infertile. That's another myth that's quite popular.
No contraception makes you
Infertile. Like,
Yeah.
some people would be like, oh, my was taking that and she couldn't get pregnant, or, otherwise it wouldn't be licensed for use if that contraception is going to result into that. I'll talk about all of them, but since we're talking about this in this context, the depot injection doesn't make you infertile, but is one of the contraception that is written there that your fertility can take a little while to come back, like up to a year, because what it does, it puts your ovaries sort of in a deep sleep. So that's the contraception that perhaps after stopping, it's like if you want to conceive in 2024, I'll be telling you to come off a year, in advance, just to give your periods time to come back.
Right.
But again, that does not make you infertile.
Okay.
Yeah, so I think the categories first, to simplify it, the contraception that does the job for you, they are called the, you've got the LARC methods. So they are...
So, before we carry on, if you can explain further the contraception or whatever method doing the job for you, what does that mean?
Actually, that's a very good question. It means it's not user dependent. Example, if I was taking a pill, I would actively have to remember to take the pill.
Okay.
I would actively have to know what to do if I've forgotten to take a pill. If I vomited, if I was nauseous, if I had diarrhea, I had food poisoning, if I was taking an additional method. So you actually have to participate and always think about what you're doing, versus if you are having a contraception that does the job for you, you sort of have a procedure and that's it. You only think about it when it's time to have it removed, in that sense. I see. So I think for convenience, especially with young people, they're very busy schedule, and perhaps, I'm not saying most young people are forgetful. I'm sure they're very disciplined and remember, but with a lot of things on their mind about fashion, about this and that, TikTok, Instagram, whatever, they may remember like, oh gosh, I forgot to take my pill. So maybe that might not be a good option for them. Rather than a contraception that does a job for them. Example, obviously, this is called an implant.
Yeah.
So this is
There is this I want to ask, because for us as parents,
yes,
especially because we know there are contraceptives that are doing the job for you, and the ones that are obviously you are going to have to do a lot yourself.
Yeah.
You know, all these come with making a very big decision, isn't it?
Absolutely.
Yeah, and especially with the background of myths like it affecting your fertility in future. How earlier on, as a girl child, do you think they can safely be introduced to contraceptive methods?
So contraception methods for, you know, for the very young teens can be started, you know, it's licensed, they can start it anytime, even if they're not sexually active. Some girls start a contraception, example, it's called a combined pill because they're having a lot of acne, you know, skin issues. So a doctor, their GP might say, you know, I'm giving you this, it's got a dual role, it's going to help your skin or it's going to help your painful periods, but at the same time, it's also going to prevent you from getting pregnant if you were to get pregnant or by the time you are going to be sexually active. Right. So by that time, that teen would have been accustomed to how she, you know, take that pill. So that's, you know, one option.
So in terms of age, it can be as soon as in their teenage years?
Yeah, there's something called Fraser competency. As long as a clinician, because it's not something you can just pick up, you need to have a lot of, you know, a consultation. Yeah. As long as you're deemed competent, you know, nobody's forcing you, there's little questions and things that can be asked, then it can safely be administered. So as a profession, it's not my role to start saying, you know, how dare you come here, you're 15 for wanting a contraception. It's too late now. There's nothing you can do. You should kind of applaud that young person for actually going to a clinic because yes, they've crossed that line, but now they want to make sure that nothing else, unintended pregnancy, for instance, doesn't happen.
And in terms of consent, because I know that say from the age of 12 to about 18, they can't consent to legally, I mean.
From the age of 16, you can legally, I'm talking about the UK, I don't know about the States or Sierra Leone or Ghana, or you can actually consent to have sex in the UK.
Okay.
So
from the age of 16.
16, yeah.
And then in terms of accessing some of these facilities, contraceptive-wise, can they go or walk into the service and ask for a request for it?
Yeah, so you know, I've seen patients as young as, you know, it stuck with me. I think she was 14, so sometimes things happening. Yes, they can. They don't just walk into a clinic. They can walk into a clinic, yes, but we have, you know, specialists, people that sort of counsel them, because we're also concerned about their safety. It's not like every person or young person that turns up and says they want contraception, we're thinking, yay, this person came. It's about why actually are you not in school? Why are you having the time to have all of the sex? What's happening? What's the background? So there's a lot of input that goes in. But I think for a young person to feel that a hospital or a sexual health clinic is an open place that would encourage them to keep coming in, and they kind of refer their friends and say, you know, go to that clinic, or, you know. Yeah.
So between, say, the age of 12 and the age where they can legally consent, can they still walk in by themselves?
Yes, like I said, there's a thing called Fraser competency that any clinician will need to do. But obviously sex under the age of 13 is statutory rape, so that's another ball game.
That's another ball game. Yeah, it's important we make it come out, you know.
Yes.
Yeah, because a lot of parents will be listening and thinking, oh yeah, my girl child is nowhere near having sex. But the thing is,
it happens.
We don't stay with them 24/7.
And I'm telling you, the young people, our generation, are super clever. You know, you mummies or dad or aunties will be like, I can swear my child is this or that, but they are so clever with how they, I don't want to say hide, but what you want me to appear as, this is what I'm going to be as, you know, to their mums or whatever, you know. So you just have to have that open relationship, isn't it?
You really do. And the more reason why it's important we have some of these conversations.
Yes, absolutely.
Yeah, so they can open up and not try to do it behind the scenes. So can we delve into the different, the ones that you have, say, control over, and then we can do the other ones as well, isn't it?
That does the job for you, So like hierarchy, let's start off with the pill. I haven't got any pill, but Well, let's start with the basic condoms. So I haven't got a male condom with me, but there is a male condom and there's a female condom. So this is actually a contraception if used correctly, meaning from start to finish. It has a, you know, it would work as a contraception. Some people just use condom all their life. Obviously, certain things can affect a condom, can make it break easily and things. So you have to consider all of that. But if used correctly, it's an effective method.
Next time we should get a model and show how to wear a condom.
Yes, that's a topic on its own.
Viewers, for those of you watching, this is our series, isn't it? We plan to make it a series on sexual health.
Yes.
Yes. So there will be more exciting topics coming in this area of nursing. Yeah. So I think we should, because sometimes we take very little information granted, you know, and that's where people have problems, and all the other repercussions of, you know, like somebody getting pregnant because a condom burst or whatever. You know, I have some very, you know, funny encounters with these like condoms and patients coming in, not in this country, but it's quite interesting actually. So condoms.
So you've got a male condom and you've also got a female condom.
Right.
Yes. So
I've never seen one myself before.
I can open it for you. So this is quite popular with sex workers, for example, because apparently, you know, maybe a client may not prefer to use condom. So a woman can insert this and the man isn't wearing a condom.
Right.
It's a bit of a hassle, but this is another option.
Right.
Yeah, would you like to see?
I would love to see it, because I know of them, and I've never really seen one. I don't remember seeing one myself. So
it's important as well to know that you've got types of condom in terms of how it's made. You've got latex and you've got ones that haven't got latex. So perhaps if someone's using a condom and they're having, you know, reactions on their skin, they're having itching and things.
Latex allergy. You can't avoid.
Absolutely. So the option is there to have latex free, and they're all high-tech ones now, you know, not like plastic, noisy or whatever. So, but this is when you get a condom, obviously you need to avoid keeping it, I don't know, in your wallet for too long or next to the heater, or you know, because it can weaken the condom. So you need to sort of keep it in an air sort of.
Is it just the integrity of the material?
Might be, you know, diminished for sure. So you need to make sure it's got the kite mark. You obviously need to check the expiry date and all of those kind of things. And the good old, you know, you wouldn't tear a condom with your teeth just anywhere. You sort of go to the corner. Now that I'm going to demonstrate, I hope it's not going to fail me.
There is
it worked.
There,
yes, and you just literally just do that.
And obviously hand hygiene,
yes,
important, you know?
Absolutely.
Yeah, so because you're not introducing any
infection. And it kind of looks like this.
I see.
So one part is in the female and the other part is held together. Shall we use this as a sort of
very interesting.
Yes. So this is sort of covering the cervix. So so whatever ejaculation is going to be held here, it isn't going to move up. So a female would sort of hold this in place and guide the penis in.
And will it stay in place?
Yes, it will if inserted correctly.
Right.
Yeah, so that's an option. And obviously when you're removing it, you have to safely do that. You don't want any semen and things spilling, because that would just make it pointless, you know, how it's used. You know.
Is it something that can be hidden away from the man, for instance? Or there is no way the man will know that there is a condom in use?
If inserted correctly, and like I said, you're sort of guiding it, holding the both sort of end, and you guide the penis in, a man shouldn't know. But I guess some men are super sensitive, but it just depends the type, you know, the brand and things that you get. Some are quite, not thin that it will break, but not so, you know, like I said, it's popular with sex workers, and
I see.
I guess their clients don't complain.
And do you train them on the use of it, or they just
absolutely? Oh no, you have to. That basic. Just a demonstration, because otherwise, you know, you'd be amazed how many people, just a simple thing, you know, condom, you know, I asked them, you know, like a patient, she was pregnant, and she was like, oh, I use a condom. And I'm like, how did you use it? And she's saying at the end, there's whole loads of different methods that humans sort of have invented, but the proper use of a condom should be from start to finish, not, at the end.
And that's why we should do it another time.
Yeah.
Great. Yeah. So how easily accessible is this one then?
Oh, you can get it online, the good old Amazon, certain sexual health clinics have it as well.
I see.
I'm pretty sure it's in Boots and Superdrug.
Okay.
But obviously this whole stigma with society, to go into a shop and get condoms, it might be a bit embarrassing.
Yeah.
So I guess that's where online sort of next day delivery.
Can they get it from your clinics as well?
Yes, NHS clinics do give
free?
out condoms. Yes, absolutely.
Really? Well, there you go. Yeah.
We have some serial
It's good to know.
attendants that that come in and.
Oh, I see. Oh, that's great. So that's the condom. And
yes.
then, yeah.
So we've got condom, and then if you are going a step up from condom, you've got what we call pills. So you've got two types of pills. You've got one with 2 hormone and you've got one with 1 hormone.
Right.
So depending on a patient's medical history would sort of determine or guide you which of the pill this person, would need. Because you have to be on a contraception that's going to maintain, your health, to be safe.
Yeah.
It's not about going on a contraception that's going to give you more sort of health issues. So that's why you have a thorough assessment. The clinician's going to ask you questions, and perhaps you might do a pregnancy test even beforehand, your blood pressure, your height, your weight, your BMI, a bit of your family background, all of them kind of things is important.
Very important.
So if it's a combined pill, you can take it sort of, you need to remember to take it. That's the whole point.
Yeah.
So, you can take it for 3 weeks on, and then you've got time off during, the month. And during that time that you have off, it's called a hormonal bleed. But patients or non-clinical people normally want to call it a period, but it's not an official period. It's just a withdrawal bleed. But for simplicity, if they want to call it period, then yeah. So during the time you don't take the pill, then you can have that bleed. But you can also have the advantage of taking it back to back if you wanted. Let's just say you've got a party, or you're traveling, you'll be swimming, and you wanted to avoid your period, so you can sort of control how many times per year you have a bleed. So that's a benefit that's quite popular with people.
Yeah, and I think we probably have to highlight some of the medical conditions that definitely have to be avoided, for instance, so you don't go on the pill at all, because there are pills that if you've got a lot of medical condition that it's safe for you to be on. So that would be the one pill, the 1 hormone pill, the mini pill. It's normally called a progesterone only pill. It's the one with the estrogen, the 2 that you have to, that certain little issues might make you not want to have that as a first choice. But the mini pill, if you've got hypertension, which is quite popular with ethnic minorities, if you're a bit overweight, all of that kind of thing, it can safely be taken. Yes. Right. But these are not, is it an off-the-counter medication?
No, but you can get it online pharmacy,
Really?
Yeah.
And is there any questionnaire, or are they going to take you through the same assessment process?
I would hope so, yes.
Right.
However brief, perhaps it might be a bit more brief, but yes, I would hope so. Nobody would just,
So people should not be taking it just, anyhow.
No, because you should follow.
The reason I'm saying this is because, like, in places like Africa, like where you and I are from, you can pretty much get everything you want off the counter.
Absolutely. It's about who you know, isn't it? Yeah. So, but I'm hoping that, with any medication, there should be a patient information leaflet inside. So even if the person just sold you, like a pharmacy that isn't registered in Africa, for example,
that is
you
one
would
culture we probably have to encourage people to. You'll be surprised how many people read nothing about the medications they are given.
They take first, and then it's like, oh, that's a side effect. Oh yeah, kind of thing.
You'll be lucky if they even take first and read the leaflets after. And that is one of the reasons why I do this program, to encourage people to take charge of their own selves. You'll be taking in the medication into your own body. You want to know what is going to happen afterwards.
Of course.
Really, isn't it? Yeah, beautiful. Okay, so what about the combination one?
So that's the combination one. So like, when you're on that, while you're on any contraception, if anything changes with your medical health, you must sort of approach a clinician and not just dismiss it, Example, if I'm starting a contraception now, and then in October I've been getting these migraines, or my mood is a bit altered, or anything, my acne is a lot, or any issue, you must speak to a clinician.
Right.
And then they will tell you that yes, this is a temporary side effect, or no,
temporary only.
yes,
So
temporary.
to continue, you can continue.
You can safely, whilst being monitored, so you're not going to be continuing indefinitely.
Yeah.
Perhaps you might take it for another 4 weeks,
Okay.
and you kind of explore other things.
Yeah.
Like a patient might be like, I've started the pill, I'm feeling a bit low, and it's like, oh, when did you start the pill? In February. Did anything else happen in February? I lost my job, my cousin died. So then you kind of discuss with the patients, and they're like, actually, perhaps I'm going through emotional grief, rather than the pill. So loads of those kind of.
Interesting. Yeah. So we've done the condom. And
Yes,
then
we've done the pills, and then
Yeah.
next we have a patch. So this is like, it's called a transdermal patch.
Okay.
The simplest way to describe it, it's like a plaster.
Yeah.
You kind of put it on, like smokers that want to
the
quit
nicotine
smoking.
patch.
Yeah, so you
Yeah.
just sort of put it on. They will tell you where it can safely be inserted on the body.
Yeah.
You change it every week, and then you have a
It's
week
a
off.
weekly patch.
Yeah, so
Oh, that's
instead
not
of
bad at all.
instead of something doing it for you,
Yeah.
instead of you remembering to take something every day, you've got something that at least 1 week you don't have to remember. So that's quite popular
quite
as
good.
well. But obviously, if somebody, let's just say, they go to the gym a lot, or they swim a lot, or you have to sort of just think,
Well,
not that you
about
should care.
showering? Yeah, like showering.
Oh, that's fine.
It
Water
won't
can
peel off.
touch, yeah. So that's why you have to put it in a certain way. And there's all guidance on the contraception, the information
Never heard of
leaflet.
that.
Yeah.
Never heard of that. Obviously, I know patches are used in palliative care, for controlled drugs and all other, but I never knew. So it's great. It's going really well.
When
Right.
it's used in palliative care, just out of curiosity,
Yeah.
like bathing a patient, do they avoid that
Yeah,
area?
well, I mean, the good thing is like plastic, isn't it?
Yeah.
And
It will dry.
Yeah, it will. You just go around it, and it quite stays intact. So yeah, from that point of view, I
Yeah.
do know from experience that it stays on.
Yeah.
Yeah, but the good thing again is, say in the acute setting,
Okay.
we would have like a daily check thing. So you know how drugs are prescribed, and
Yeah.
you follow to sign for it and all that to see whether you've been administering it. Yeah, there is a daily check for patches like that, especially the controlled drug ones.
Okay.
Yeah, so that we know it hasn't come off, because these
Yeah.
people are really sick, and the last thing you want, you trying to manage the pain, the last thing you want is for the patch to be taken off during like personal care,
Yeah.
and then the patient ending up in pain.
Of
So
course.
yes, there are daily checks, and you have to actually physically look at it and then sign for it to say that yes, it is there.
Strict.
Yeah,
Good.
till it is replaced on the next due date.
Yeah.
Yeah. So that's how it is, and it does stay in place for the whole duration.
That's very
yeah.
reassuring.
Yeah, that is just by the way, isn't it? Yeah. Okay. So patches. Any
And
other
then
ones?
after the patch, we'll go for it's called a vaginal ring. So the closest way I can describe it, it's like a plasticky. So if you imagine something like this without
Okay.
the condom bit, which is like, it's sort of bouncy, you can literally do it like this. So
Okay.
if you're inserting it, you would squeeze it in like this, it goes in, and when it goes in, it will just stay open in place.
What, the vaginal ring?
Yeah, so that can stay on for 21 days, 3 weeks.
And is it hormonal?
Yes, it's got two
Really?
hormones. So that's quite popular if somebody, doesn't want to be remembering to take a pill every day, or they had a lot of, side effects with the pill, like they feel nauseous, or
Yeah.
they're taking, because this is more localized. It's sort of,
Right. And how
Focuses
does that
on the-
actually work? Like what
it
what
releases
is the-
hormone,
It's
and
hormone.
yeah, it's got
Right.
two. It's got estrogen and progesterone.
Very interesting.
So that's quite convenient as well.
Yeah.
There's no way it's not, it's going to fall off. It stays, it's not a magnet, but when you insert it, doing this, it kind of just stays in place.
Okay.
And when you're removing it, it comes out easily.
I see.
I'll bring one next time.
You
Yeah,
should.
it's
I'm fascinated. because I've
I
not
know
done this
technology
for
is
a
just,
long time. It's amazing, isn't it? What is on the market now?
and I'm
So we've done the ring. Yeah, sorry.
I'm
go
pretty
ahead.
sure it's in Africa as well. 'Cause
Really?
I would hope so. Africa's, yeah.
I'm
I would
feeling
hope
really
so.
old now because I mean, seriously, I should be knowing some of these
No,
things.
well, if I wasn't in this speciality, perhaps I wouldn't know as well. So
No,
there's a lot
no,
of,
and that's what fascinates me about this.
yeah.
Yeah, having you guys on. So thank you very much. And
Mm.
yeah, what else? And the
So then
ones
we
that-
go to the implant. So that's something that goes into the arm. It can stay in for 3 years. It involves a procedure for it to go in. It kind of looks like a matchstick. It's literally this big,
Okay.
and nobody will be able to see, through the skin. But if you kind of press through, you would sort of feel.
Yeah.
If you had that in your arm,
Oh,
that's
okay,
what
so
you'd
this
be
is going to
feeling.
be like
Your arm, yeah.
Okay.
So like if somebody held your arm, they'd be
I
like,
see.
"Oh, what's that?" kind of thing.
Yeah.
Implant
you
is
can hardly feel it, isn't
yeah,
it?
and this is quite popular in cultures wherein perhaps, shall I say, a woman may not want to conceive, and perhaps husband might want to conceive, but it's not the right time, and
Yeah.
there isn't a good negotiation and things.
Yeah.
And if the woman's taking pill, perhaps it will be quite obvious.
Yeah.
So that's one of the things. In certain ethnic minorities that I see, it's quite popular in that sense.
Yeah.
So I'm not saying that. I'm not advocating
Of course, I
anything,
mean, it's
but
been
this
new,
is
isn't it?
yeah.
Yeah, because you don't always come to a consensus in marriages, like
Of
when it
course.
comes to these things.
Yeah.
Yeah, and in our background, like with polygamous marriages
Yeah.
and all that, you really have to take charge of your life.
Definitely.
It's about you at the end of the day, isn't it?
Yeah.
Yeah. Okay. So yeah.
So
any
after
more
the
on-
implant, you've got the coil. So
Yeah.
you've got coils that has hormone, and you've
Okay.
got coil that doesn't have a hormone. So out of all the coil, the most effective, reliable in the UK is the copper coil. So that is valid for
and
use.
the copper tea.
Yes.
Yeah.
So it works by the copper.
I know that one.
Yes.
Yes.
And personally, if I had to choose, that's my favorite because
Really?
I think hormones can affect people,
In different ways.
Yeah. So copper doesn't have no hormone. You're not going to complain about weight gain or mood changes or spotty skin or whatever.
Yeah.
Though it does make your natural periods heavier, longer, and more painful. But sort of if you weigh it up, that's just once a month.
Yeah.
So some women would rather prefer that. So again, this is a demonstration of what the womb would look like.
Okay.
Yeah, so I'll just take it
Very
out.
interesting. Yeah.
Our body is just so clever, so unique.
It is, isn't it?
If we all had a
Yeah.
mirror that you could see what's in, it would be fascinating.
You probably don't want to go that route.
Imagine if you're walking in your house and you're seeing your kidney and pumping
oh my
or your heart
goodness.
beating. That would
Yeah,
be
you probably have a heart attack. So yeah, good thing we don't get to see
those details. Yes.
Yeah,
So
okay.
that's a 5-year coil. It's got the
A
copper.
5-year coil.
Yeah, so it's a non-hormonal. So you've got a 10-year one, which is
Oh.
this, and you've got a
Right.
5-year one, which is that.
Okay.
So the 10-year, you differentiate it. It's got coppers on the arms,
Yeah.
and this one just has on the stem.
Right.
So they're both as effective.
Okay.
I guess if you want to prevent pregnancy for a longer time, perhaps you'll prefer
yeah.
the 10-year versus the 5. But you
Yeah.
can have the 10-year and take it out in 2 years. Your body.
Yeah.
No one's going to, tell
And
you off
can't
or anything.
conceive straight away.
When you remove it, literally,
Yeah.
you can take it off in January, and if it's not your fertile, if it's ovulation time, you have sex, you will get pregnant.
Yeah.
So it doesn't delay fertility or anything.
No.
But like I said, important for women to know is how it affects your period. Can be slightly heavier, longer, more painful, but
Yeah.
it does settle.
There have been stories of babies holding these
Holding,
copper
yes.
Yeah, I really do know that because we had to speak to the women about it back in the day. Mm-hmm. How does that happen? And is
Well,
it even true?
Technology, it has happened because I have read journals,
Really?
but things have come a long way now, and we empower women. We tell them to check for their strings,
Yeah.
because this bit is in the the womb, and you've got your threads there, and you're supposed to be checking perhaps every month after a bleed, or even
Yeah.
if you're not bleeding, or in the shower, that kind of thing, or whenever you go for your smear test, ask the clinician, can you see my strings?
Right.
And we'll tell
you can still go for the smear test with it
this
in place.
inside, yes.
Right.
Because the core sort of
Ooh.
sits here,
Yeah.
all the way up there within your womb, and only just
I
a
think
little.
if the producer can just project this on, so
Oh,
we see
right.
how it sits in the womb, and you can straighten it. and-
Yeah.
yeah. Okay. And
So it just sits there doing its job.
Yeah.
And we teach, you how to check for your strings. And obviously during the consultation, they will tell you what and what you should or shouldn't do.
Yeah.
If you're somebody who's having a period, suddenly you don't have a period, it should be like, hey, what's happening?
And
So
what's the science of how it works? What's the science of it, really? Like, how does it work?
Oh, the copper coil, it will prevent pregnancy with the copper wires, and whereas the hormonal coil, it has hormone on the inside, which makes the area hostile, thickens the mucus and things like that. Yeah.
Right. So
we'll go
stop
more
implantation altogether.
Yes, the presence of it will prevent any, form of conception or any child growing in there.
Okay.
But like when you've got the coil, you've got risk of things that you're thinking about, ectopic pregnancy. That's why if someone's got the coil and they're pregnant, you're thinking, has the coil moved? So we do teach and counsel patients what and what to look out for.
Very important, isn't it? Yeah. I've used one before. Yeah. And that's why I have very good family planning.
Yes, absolutely.
Decent gaps. You see, I like to talk about these things, and people will say, oh my God, why did you say that? And that it's so important that we share our own experiences. I have big gaps in between my kids, like 5 to 6 years between all of them, because I took charge of my life pretty much earlier on. And it's very important we let others, take charge.
Definitely.
Lovely. And is that all for...
But you've got other contraception. You've got the diaphragm.
Right. How does that work?
So again, that will stop any form of sperm.
So that's also for use by the woman?
Yes.
Right. Okay.
This might not be too, what's the word, appealing for a young person.
Okay.
A 16-year-old. Because there's a lot of fiddling. You have to sort of pre-plan when you're going to have sex.
Okay.
You can't just put it in. You put it in, it stays there for a little while after sex, and it must be removed. So there's a whole mechanics and things like that. It's popular with patients in the menopause. Some of them, I have lots of patients who like that. But it's any contraception has to be patient choice. So there's no thing that says this contraception is only for 21-year-old and this one is for 50. It just depends on you. Some people, use natural family planning, but if you're using that, you have to use it properly. So it's not just about looking at the calendar. You must, check your mucus, your calendar, so you have to do it properly.
Right. Yeah. So at least we've gone through the ones
you've also got the depot injection. Yes, so that's every 12 weeks. So if you've got the depot, you go into a clinic and a clinician will administer it for you. But you've also got one now that it's called Cyana Press. You can administer it yourself at home. So that's quite convenient, isn't it? If you're not needle phobic or you're not scared of injecting yourself.
Yeah, good. I mean, so far so good. I'm sure people may be watching and they would want to ask questions. So we will link up in a minute. So are these all the types, at least like an overview of the types that we have? Yes,
there's obviously if somebody wants a more permanent, because most contraception are reversible, meaning fertility gets back to normal, but you going into sterilization. And I think we have to talk about men. Men choices would be condom, and men choices would be vasectomy.
It will probably be great to put that towards the end so I can hold their attention, with the hope that they will stay on and listening to their options as well. With the men, I can see you have a device on there, and that white.
Oh, this is just where the coil, the introducer, where.
Oh, for the insertion of the coil.
For demonstration purposes. So this is how it comes in. It sits into this little capsule here.
It's not really a painful procedure, isn't it?
I'm not going to say it's not painful. I would call it painful, but you've got the option of local anesthetic. So it's.
Do you?
I don't want to say survivable. That's a big word as well. But discomfort, should we call it that?
I mean, obviously people have different pain thresholds. So they have options if it's uncomfortable. And
you talk to the clinician, just tell them, give me a moment, things like that.
Brilliant. And one area that I found fascinating reading, the stuff you sent to me was contraception for specific groups. can we start looking into that? Because I thought that was interesting.
Yeah.
Now,
So I
yeah.
think like we can, based on sickle cell being heightened in the sort of ethnicity,
Yeah.
the DEPA contraception is a good option because it kind of manages the sickle cell crisis. It makes it less painful. So
Okay.
that's something you can take if you've got sickle cell. It's
So
highly
our first group
recommended.
is sickle cell patients.
Yeah. So that if you're asking me
Okay.
what contraception is best for me to have,
Yeah.
so that I would recommend the DEPA because it's got a dual
DEPA.
advantage. Yeah, DEPA
Right.
injection.
And the advantage again is?
It's with your managing the pain level during your sickle cell crisis.
Really?
Yeah.
Okay.
So that's recommended.
I see. And there is no side effect like blood clots and with their crisis and all that? No?
No, it's a
safe.
safe, what we deem safe for them to have to be on.
Very interesting. And is that the only one they can use? Or
Well, they can use a non-hormonal contraception,
Right.
but like I said, it's not just having one medical condition. There's a whole holistic sort of view and assessment that will be done
yeah.
that will determine. You can tick all the boxes to have this, but then you tick all the boxes not to have it. But it's
Yeah.
when you have a consultation that will sort of come out.
Yeah.
Like if somebody is HIV positive, a woman, first of all, if a woman's HIV positive,
Yeah.
if she's on medication and her viral load is undetectable, it's called U equals U, it means she can have sex without a
I
condom.
love that. Yeah.
It means she can have
yeah.
sex without a condom and not be infectious,
Yeah.
which still, it's kind of hard to swallow, but it is true, I'm telling you,
Yeah.
it's true,
I've done that topic with Comfort Your Colleague.
Yes, absolutely.
Yeah, and it's a long time ago. I would love for us to do that again.
Yeah.
The HIV
Yeah.
subject, because of course it's on the rise again. Apparently, isn't it? Cases all over the place. Yeah. What are their options then? The
So they
HIV
can
patient?
have any of the intrauterine device,
Okay.
or they can have
Really?
the DEPA injection as well. Yeah, because the DEPA, it's got the advantage, it's not affected by any sort of medication. Because
Okay.
certain medication for drug interactions, it would affect the contraception. So all of them kind of thing has to play a part. For women who, the average age or the mean age of the menopause in the UK is 51, but it can range from 45 to 55.
Yeah.
So like if you're at the cutoff age of 45 and you're having contraception, you could have any of the intrauterine device. The Mirena is known to work, hand in hand with your HRT. If it's inserted in certain time of your life, it can stay in until you finish the menopause. When you've accomplished the menopause, contraception is it's not needed anymore.
Right. But that has to be confirmed. You have to be sure that
Absolutely.
to avoid any pension babies, of course.
Yes, and I think women are always shocked, like really, but
Yeah.
you can get pregnant.
Yeah, you can.
So
Of course, yeah. If you don't take charge, of course you can get pregnant. So we've done the HIV positive patient and their options: sickle cell, menopause or over 40s.
Yeah.
Yeah, and then one big area of interest is probably after birth.
Yes.
Yeah.
So depending on whether you had vaginal delivery or you had a C-section will determine when you can have the coil.
Okay.
Yeah, because there's certain coil that you can have within 48 hours versus one that you need to.
48 hours after delivery.
Yeah, and there's a whole thing about this woman has just given birth. Why are you talking to her about contraception? But you must. That's the time to tell her. Because it's possible you hear women being pregnant, their child is 7 months or 6 months and they're pregnant again.
Oh, that's
So
even old. Yeah, they are
even shorter. I was
siblings
being
that
nice.
are like a month, less than a year apart. So
Yeah. So I think
also-
that discharge from a hospital is important. But I know now, I've had colleagues tell me that they give them a discharge pack with all the information there about contraception. Yeah,
I
and
would hope.
yeah, I would hope. Or when they have their first, visit from the, what are they called,
Yeah,
the nurses,
health visitors and
that's it.
midwives,
Yeah, I'm pretty sure they mentioned that. And lots of myths again. Patients will say, I'm breastfeeding, therefore I cannot get pregnant. But if you are, you must do it properly. It has to be exclusively breastfeeding.
Yeah.
So it's not just about you breastfeed during the day and not doing it at the night, or you're part bottle feeding,
Yeah.
and as your period resumes. So you must be guided and do things properly for it to be officially,
Right.
Is baby more than 6 weeks, more than 6 months? All of them kind of things can play a part.
It's a lot of information to take in for that group of people, isn't it?
Yeah, or the contraception with the one hormone, the progesterone, it's sort of safe if you're breastfeeding and things like that. So, but like I said, you have a clinical assessment, and then
I can't believe you can use something like as soon as like 48 hours after delivery.
yes,
Yeah,
it
can you
can
go
be.
over that bit again?
So that's a
Like,
coil, the
the
uterine,
coil, straight away.
yes. But if it's not done within a certain time, you're obviously going to be, it's not a license, to be inserted after that time. So you have to sort of get in there when
Yeah.
it's,
Very interesting.
yeah.
Yeah, good. Now, is there any other methods or anything else we want to be discussing, or we can start looking at the myths? you know?
Yes. So, lots of myths, like I said, if withdrawal method doesn't fail as long as it's with, there's withdrawal, that's, it can fail. Pre-com does contain sperm, and if they're fast swimmers, can get you pregnant. So this is why, I don't know if you used to watch Jerry Springer or something years ago. When I was my daughter's age, I used to watch that. And the DNA test will show you are the dad, and the man is like, but I did not ejaculate. But it's the pre-com that stay there and fertilize that egg. So that's a myth. If you absolutely want to take charge and not just leave it all to a man, then do something about it, and it's your body. I think if you're pregnant, it's going to be anyone's going to be affected. The majority of the person affected is you. Your body change, your partner is going to help with night feeds and play a part and be supportive, but you are the person, emotional, everything is you. So I think you need to take ownership, and it's your body.
Absolutely. It's all about empowering women, isn't it?
And young people, teenagers have said if they have sex standing up, they can't get pregnant. I've even had one tell me that you have to drink a glass of salt. And how on earth is that going to get to your room, or all kind of craziness. So I don't know where they get this information. So I think
I see.
Things like that.
Or
the good old thing about if you take contraception, you're going to be infertile for life. Otherwise, it wouldn't be official. It wouldn't be a licensed method.
Yeah, I think it's about time. Let's see if there are people joining us on Facebook and YouTube. If I can access those Facebook and YouTube, that would be great. But in the meantime, the guidance on choosing the best one for the individual. I think when you're making a decision about what contraception you're going to have, you need to think, example, you're thinking of the pill. I'm somebody that's forgetful. Am I really going to remember to take the pill? So then that would be not a first choice. Or I'm someone, I really like putting I don't want anyone seeing what I've got. I want my contraception to be discreet. Then perhaps you'll be thinking of an injection, implants, things like that. So you sort of have to think about your personal life and how that can be incorporated with the contraception that you're using. Some people want it to be hidden. Some people want it to be out there, to be seen. So it just things like that you have to consider. Have you got family history? Definitely.
Have you got underlying conditions? Various things.
And then there was one thing you mentioned earlier, emergency
contraception. Yes. So if you've had contact and you've forgotten to use a condom, or there's contraception failure, you've forgotten to use your contraception how you should, there is an option of a copper coil that can be inserted as an emergency. So so it can be inserted as an emergency contraception or something long term. So if it's for an emergency, you would only put it during perhaps 21 days, and then you do a pregnancy test to make sure it's worked, then remove. But it makes sense to keep it in as a long-term sort of contraception option. So that can be inserted up to 5 days after sex, or within a certain time from your cycle, your menstrual cycle. The next you've got the tablets, oral tablet levonorgestrel, so that can be taken within 72 hours. 72 hours is maximum.
Yeah.
You know, they are meant to stop ovulation, but the most important thing is not when it says 72 hours doesn't mean you wait until it's the 69th hour. You can literally take an emergency contraception 1 hour after sex. The sooner you take it, the better.
Yeah.
But obviously, if you've already ovulated, you know, because it's to prevent ovulation, but if ovulation has occurred, then it's sort of you're having it in good faith, crossing your fingers and toes. And then you've got another pill, which is ELA1, or it's called olapristal acetate. You know, that's 120 hours, which is 5 days after sex.
Really?
So you've got the options are there.
There are options, isn't it? And
Yeah.
you have a time frame to work
Get
with
it,
as well.
but obviously, you know, with cost of living and things, you know, because it's important, I think, for viewers to sort of know that, you know, like I can't say for other countries, but I'm pretty sure they have free or accessible emergency contraception, perhaps like charities, Mary Stopes in Africa, or I know they do in Sierra Leone.
Yeah.
I'm not too sure how the extent, but yeah. But in England, if you're under 21, you go to certain clinics. If you're in university, if you go to sexual health clinic, you can get a emergency contraception for free. Otherwise, it would mean you just have to pay, which is such an inconvenience. But whatever that charge would prevent 9 months of pregnancy if you have to wait up.
Absolutely, and I know for a fact that pharmacies are doing it. Some pharmacists, because I've got two kids who are pharmacists, and
they do the consultation.
Doing the consultation, yeah, it's part of their extended roles that they have to do.
You don't need a prescription.
No, you don't need a prescription. So it's great to know. And when is it like contraception no longer required?
If you're not having sex, as in 100%, you know that's it, or menopause. Yeah.
Menopause can be tricky though, isn't it?
It can, yeah. You can't be half and half. So there has to be an official sort of yes you are.
Yes,
just
you are
signs
definitely.
and symptoms and further tests and things like that.
Yeah. Anyway, like and then there's the more permanent methods, isn't it?
Yeah, like sterilization. It can be reversible, but yeah. But again, that's not just you walk into a place and say I want to be sterilized. There's a whole lot of filling in papers and cancelling, because the thing is, if you change your mind, but that's an option.
I wanted to say about the condoms, like from ages ago, and I remember working in a hospital somewhere in the emergency department, and a couple comes around and say the condom is missing.
Yes,
we didn't find
quite
it in
common.
The room. It is quite common, isn't it?
And you have to take it out.
Yeah, and then they said we have to take it out, and and they look poor couple.
I know they're so embarrassed, but this can happen,
Yeah, fortunately we never found it.
Oh gosh,
that was even worse for them, because they thought, oh my God, it's falling into my abdomen. So I mean, just out of interest, people need to know that it cannot go any further.
No, it will not travel. It will stay there,
unless
hidden.
It punctures the uterus, of course.
Then, which is in a standard condom. Exactly. But no.
Yeah, but that was quite interesting. But it's very common, isn't it? Yeah. Wow. So anyway, any websites people can rely on, the legitimate sources?
Yes, so like the NHS website, if you just type in contraception or sexwise.org.uk, or the FPA website, Brooks, loads of websites. That's free. All the information's there.
So the good sources of all these information.
Definitely.
And I feel obviously, because we want to make this a series, I think tonight I'm going to hold off with those watching and their questions and all that.
Yes, and we can touch on them.
And then I can take my time, or we can both watch it.
Yeah.
And then address them properly.
Of course.
Because sometimes we touch on it, and it's very important we get it right. Yeah. So I think it's been just awesome.
Oh, thank you so much. It's been like a conversation.
Yeah, of course. That's what it's all about.
You did say that.
Yeah, just getting the information out there to our people, just trying to bridge the gap.
Of course.
The knowledge gap between the health professionals and, of course, our clients, our patients.
Definitely.
You are very welcome anytime. Are there any people you want to shout out to? I know your colleagues will be watching.
Oh gosh, yeah. You know, my daughter's in the studio. She must be like, I'm sure if I call her name, she's going to be like, Mommy.
Yeah.
But yeah, my son, my mother, my husband, my family. Just big shout out to all of them.
Yeah, I'm sure they are all watching. And
yes.
You've been amazing. So
thank you so much.
I cannot wait for the next.
Yes, I can't as well.
Yeah, series. Yeah, and I'm so glad you want to even take this to like the level of us having series, because there are so many endless topics, isn't it, that we can
even
look at.
Contraception. This is just a summary today. If we want to talk about it, it's like a series per contraception. There's so much.
There's so much to talk about. But for an overview, it's been amazing.
Thank you so much.
And your colleagues, you want to shout out to them?
Oh, they're watching.
They're watching. Yeah. I think you've been fantastic. Yeah.
Oh, thank you.
I thoroughly enjoyed it, and I think it's so much. It's full of content. So we will go back, look at it, and see what questions we have, so we can address that
on the next time
we go into another topic.
Absolutely.
Viewers, for those of you who joined us, we've been looking at contraceptive choices for women. Now, before we round off, can we look at what options do the men have? Because
men. Yes, abstinence if they do not want to
I'm sure
go to female.
That's not an option.
I'm sure they're like, boo, boo. Yeah, that's too much to ask. But condoms as a basic, or
but know how to use it.
Use it from start to finish, not at the end, or kind of drama. And it's quite embarrassing for men. If a man goes to a shop, that he's going to say, they ask you what size, every man is going to say, oh, extra large, just to be a man. If you are a small or a medium, be honest about that, because if you're putting on an extra large and the penis is not built for an extra large, it's going to break.
They don't really know their size to request for the size that they
There is a size, I'm pretty, is it Durex? I'll let you know the next time, but there is a sort of guidance thing wherein when the penis is erect, you put it through the whatever the hole, and you
really
so that exists.
We should do
but that's important for you to make sure it's the right size. Make sure there's no sometimes people will be using, I don't know, bio oil or coconut butter or whatever for lubricant. You need to make sure you're using water-based lubricant, the correct thing, because certain products
use lubricants,
but it has to be certified, water-based, and not just man-made vegetable oil or olive oil or whatever else. So those are the things that can affect condom. So they have to think about all of them kind of things. Of course, vasectomy. If they are really daunted on, I do not want any more kids, or I want to give my partner a break from contraception, but the penis is so precious for men. Thinking about surgery, that might not be
anything around that area. It's almost like a no-no. But it is safe, is it?
It is safe, absolutely, and it can be reversible as well. This is the thing, if they change their mind.
Really?
So choices are there. There's work in progress contraception for men. I think it's in the US or whatever. So hopefully,
what
that comes.
Exactly is that?
I don't know. I don't want to go into it too much, but I have seen articles on contraception, for men that's in progress. So that would be quite interesting.
That should be interesting.
Give women a break, isn't it?
Yeah, I mean, we do most of the hard work. And most of the time without the support of even the man.
Yes, absolutely.
So it will be good to get them involved, and they do their fair share, we do our bit. Viewers, if you've joined us from the beginning, like I said, we were looking at the contraceptive choices that is available to us mainly as women. Obviously men, you have listened to yours as well, but for the women, it's always important you take charge of yourself, and no other way to do it than especially to do it in your reproductive years,
Of course.
And there are sometimes like a few of the male friends I talk to, and they say, oh, my wife doesn't want to sleep with me, and they are getting boring, and they are a lot of the time it's just the fear of getting pregnant. And so they don't enjoy sex as much,
because there's a whole lot of anxiety afterwards.
But you don't need to be anxious. It works better actually if you do it with your partner, to make all these choices, and then everything goes on smoothly. Guys, Like I said, I'm your host, I'm Mrs. Winnie Ohinekisi, and in the studio I've had Mrs. Edith Barber with me, and we've taken time to look at all the choices that we have. We plan to make this a series. All this has come to you live from Omega Live TV, based in the UK in Walthamstow, and yeah, they give us the platform to do all of this. But for all your media works, guys, you can contact them. So they do so much more than just giving us the platform to do this. So until we come your way again with another fantastic edition of Let's Talk About Health. Yeah, it's been amazing having you here, Edith, and I hope you come back soon so we keep the series going and keep the information flowing as well.
Definitely.
So yeah, from me to all of you, stay safe, take care. It's been great, and I love doing this and giving you all the information. Thanks for watching. Keep sharing. We'll be back. Thank you. Bye bye.
Thank you. Bye bye.